Today we have a meeting organized by RIMS, a European Network for Healthcare Professionals in MS Rehabilitation and Symptomatic Treatment. And we organize a full-day strategic meeting on adherence for patients with multiple sclerosis. As we have effective therapies, drugs therapies, symptomatic treatment, medical devices, rehabilitation, active lifestyle. However, not all patients are aware about it, or they don't really know the intensity they need to practice and the importance to maintain their activities and their treatment.
We have a lot of medications that can be effective, that can help people with multiple sclerosis. It can reduce relapses, they can slow progression of the disease, but if they don't take those medications, if they're not adherent to the medications, then they won't be helpful.
MS is a very complex disease, and if you can, together with patients, elaborate a system that will ultimately do them well and really psychologically get them on board to then follow that system, it's hugely beneficial for everyone. Issue is, and that has been very, very nicely discussed, or very, very intensively discussed, is that there are important barriers to adherence. I mean, one of them is that it's heavy medication with loads of side effect, and then with sometimes not so well conveyed impact.
One of the takeaway points is that you can make a big difference by communicating better. The key thing should not be to just make people take more medicines to improve adherence as such. The key thing should be to empower patients, to understand their options, to help them to make the decision to stay on treatment if that's what feels good for them.
Traditionally, the power base has always rested with the clinicians, and I use that in the broader sense. I'm talking about doctors, nurses and therapists. We need to shift that power base so that it's an equally shared power. We need the security, the safe, secure, shared and pooled space which allows for information exchange, agreed understanding, shared decisions, agreed mutual actions, and it's an unfolding journey between the person with MS and the clinician and the team, actually.
We have a lack of knowledge what is driving adherence among patients, so we need more research. We need more research on qualitative grounds, so interviews with patients. We need more research in longitudinal studies, knowing how adherence issues change through time, what are factors which are relevant for patients, and this might enable us to develop interventions, tools to better guide lead to adherence in the future.
So on the political level, it's important that we realize that we have a lot of effective treatment methods, models, but that we need resources to be able to implement that, and that every patient in Europe have the same access to care, independent of the country where they are living in.
The thing that encourages me about the presentations today is the degree to which people are really starting to think about these issues and to think about these issues in MS. And we're getting lots of different perspectives from sociologists, psychologists, neurologists, and I think that the accumulation of this knowledge and the accumulation of these different ideas is going to hopefully help bring us to a new era where we really think about the patient, put the patient first, and let them help make decisions regarding their own care.